in all transparency, I gotta let you guys know, this isn't my presentation. Someone else put this together who's moved on in their career. So if we go through this and it seems like I'm making things up and I'm shooting from the hip, it's because I am. So bear with me here. The other great thing about being able to speak to you when Shannon Coleman over there said, hey, Cory, why don't you come and speak at Lunch and Learn? You get to be the guy that goes after the exercise and right before lunch. And that's great, Shannon. Thanks for the great time slot. So not only do I get to give a presentation that I didn't put together, I get to give the one that everyone wants to get over the quickest so they can go eat. All right, so medications in memory. I thought it'd be kind of funny if I came up here and I pretended like I forgot what I was going to present, and then I took a pill and popped it, and all of a sudden I remembered. Because, that's kind of what we all want, right? But unfortunately, that doesn't exist. And so there's not a medication out there that's going to help you with your memory, but there are things we can do about medications to make sure that your memory stays intact. So I'm going to try and hit on that today. So I think you guys have already talked about the brain quite a bit already today. Here's what I know about the brain. The brain needs oxygen and it needs sugar to work. So before I came here, I ate a lot of donuts and the warm-up was great. So now I'm ready to go to give this presentation. So the Beers criteria. Does anyone ever heard about the Beers criteria? So the Beers criteria, this is a list of medications or drug classes that are put together by the American Geriatric Society. And this list of medications are thought to either to be completely inappropriate for elderly Americans, or this should be used with caution. And the reason is that you guys have heard about how your brain tends to slow down over time. Well, so does the rest of your body. Your metabolism slows down over time. And you may have heard the word metabolism associated with diet and things like that. Well, metabolism is also associated with how your body breaks down medications. And so when you take a drug, it stays in your body for a certain period of time, and your liver and your kidneys help get rid of that drug. And as you go older, the liver and the kidneys' ability to do that slows down as well, so a drug stays in your system longer. And not only does the drug stay in your system, so does the metabolites of that drug. So you may take a drug, and it goes through your liver, and it gets broken apart, and those pieces are called metabolites. And then those metabolites stick around in your body, and sometimes it's the metabolites are what causes the side effects or are causing the problems, not necessarily the initial drug. And so as you get older and they stay around longer, those side effects can accumulate, they tend to persist, and it causes a decline in cognitive function, which you guys just heard about in the first, the other presentation. So it's the accumulation of these metabolites that causes the side effects that decreases our cognitive function, and that is what the Beers list tries to help avoid. So neurotransmitters, you guys have talked about that already. What medications that affect the brain do is they either enhance these neurotransmitters, they block their action or block their release from the synapses that you guys have been talking about. So any type of brain med, these are the targets that they go over. And as some of those brain medications are on the Beers list. So, if you are taking something that's supposed to block serotonin, and maybe it starts to block it a little bit too long, and now you're no longer having the desired effect of the original reason why the drug was prescribed. So every once in a while, Medicare will come up with a good idea. And Medicare and what we've done at Samaritan Vantage is we've taken some of those drugs from the Beers criteria and we've classified them as high-risk medications. And these medications have research that shows that they can be dangerous in elderly people. And they can lead to increased falls. They can cause you to have prolonged side effects. Like one of the things I learned in pharmacy school, there's the 4 good general ways to classify side effects. You can't see, you can't spit, you can't pee. I'll let you fill in the last one. So they call Those are called anticholinergic side effects. So it causes blurry vision, it causes dry mouth, it causes urinary retention, it causes constipation. And a lot of times you'll have those problems that may be a side effect from a medication that you're taking. You go see your doctor or whoever, and you tell them about this problem that they're having. And they say, oh, I got something for you. Let me give you another drug for that. Well, now you're taking a drug to take care of a side effect. And then that drug causes another side effect. And then you're on another drug to take care of that side effect. So over time, all of a sudden, you're on 10 or 15 drugs. That's called polypharmacy. And really, all you needed to do was take a good nap and have a bottle of wine, right? That's what we've been talking about. But the point is that, when I've worked in the hospital and things like that, I would see people come in and they would be experiencing delirium and that sort of thing, and we would end up stopping all their medications, and over 2 or 3 days, all of a sudden, it was like the person woke up. They're a brand new person. They're able to think clearly. They're able to talk. They can remember their words and all those types of things that we've been talking about, and that's because all these medications build up in your system over time. They hang out longer. There are a lot of metabolites, and it takes your body longer to clear those meds. And so that causes the decrease in cognitive function, and it creates the appearance that you can't remember anything anymore, or you can't speak clearly, or things like that. It's not because your brain is necessarily not functioning anymore well. It's because your medications are causing your brain not to function to its full potential. So, high-risk medications. You might present to the pharmacy with a prescription for a drug, and you may have been on it for years and years, and all of a sudden you find out, hey, I have to have a prior authorization for this. What the heck's going on? Well, it could be you've reached a certain age, which now puts these drugs in this high-risk medication category. And what we want to do is have your physician have a discussion with you to talk about the risks of taking these medications at your age. Because after a period of time, the risks are no longer greater than the benefit. And all we're trying is to make sure the physician's aware of that, and that more importantly, you guys are aware of that, so you can have those conversations with your physicians when you're on these medications. Say, hey, is this really still a safe med for me? The fun part about that is that every year, that medication gets renewed, we're asking the provider to provide documentation that they've had that conversation with you. So if you're on some of these meds and your doctor has not talked to you about that, I encourage you to initiate that conversation with your doctor. Like I said, these medications are associated with fall risk, they're associated with adverse drug events, hospitalizations, morbidity, mortality, things like that. So here's some examples of these high-risk medications. So the first one are tricyclic antidepressants. And these medications have a lot of those can't see, can't pee type side effects. They also cause an increase in falls, sedation, and can cause delirium. Some examples of these, and maybe you guys are on, some of you are on, and these are amitriptyline, nortriptyline, doxepin are the three most common ones. And these medications are not only used for depression, they're also used for treating pain, they're used for insomnia, things like that. So really, they're taking advantage of their side effects to treat something else instead of what the drug was originally designed for. Another popular class are anti-anxiety medications, specifically benzodiazepines. These meds, they can definitely increase sedation, and they also have the potential of causing amnesia and delirium. So how many of you here have ever had a colonoscopy? Well, that's surprising. Actually, it's not. How many of you remember it? Right? Not as many, and that's because you were given a drug called Versed, which is a benzodiazepine that causes amnesia. So that's also sedating. But when you go in for your colonoscopy and you got that Versed, you didn't get the Versed, so you wouldn't remember the colonoscopy, because who doesn't want to forget that experience? But that medication, one of the side effects is amnesia. And so that's why a lot of times you don't remember that procedure, because you were given that benzo. So these are other examples of benzos that you get from your physicians, and they come as an oral form. So Ativan, Xanax, Valium, those are the common brand names, but you also might know them as lorazepam, diazepam, alprazolam. A lot of these medications are also given for folks to help them with insomnia and sleep and things like that. But again, just take the nap and drink a bottle of wine, you're good. My wife always says she wants the Valium, but if you knew my kids, you'd know why. Another popular class in the high-risk medication group are the Z drugs. These are hypnotics. They help you sleep. Probably the most familiar one you guys might have heard of is Ambien. Some of these drugs are designed to help you fall asleep, but they're only supposed to be used for maybe 1 or 2 weeks at the most. But a lot of people get on these drugs and they stay on them, and stay on them, and stay on them. Because their sleep habits aren't very good, things like that, and they feel like they can't sleep without them, and so you kind of get a little bit of addiction to them. I don't want to use the word addiction because it's not a true addiction like with an opioid or something like that, but you feel like you can't sleep unless you take these medications. The problem is with these medications, if you do wake up in the middle of the night and say you have to go to the bathroom or something like that, your cognitive function might not be where it needs to be. Maybe your hand-eye coordination isn't what it needs to be. You walk into the bathroom and you slip and fall. That's when you break a hip, that's when you break a leg, and now you get to come see us in the hospital. The next group here are narcotic painkillers. Now, interesting enough, the narcotic painkillers or opioids aren't necessarily high-risk medications, but we do take a good, strong look at these. And there's a lot of movement right now in not only within our community, but all across the country about the opioid epidemic that we're currently in. And we're looking at things that we can do to help decrease the prescribing habits of these medications, especially in chronic pain situations. A lot of research is coming out now showing that opioids for chronic pain is probably not the best choice. There seems to be an increase in morbidity, an increase in death, and just a general decline in overall health in people that are on these medications for a long period of time. And what they're known to do is they also can increase sedation, so it makes you tired and sleepy, and it will increase your respiratory depression. And so basically what they can do is turn off your brain telling your lungs that they need to breathe. And remember earlier I said your brain needs oxygen to work, and if you stop breathing, your brain doesn't get oxygen, and away you go. Especially when you add a benzodiazepine to an opioid. So if you're on lorazepam or Ativan or something like that, and you're also on chronic opioids, that's not a good recipe. And you really want to see if you can talk to your physician of weaning you off those medications. Some good examples of opioids are oxycodone, morphine, fentanyl, hydrocodone. You might also know these as Percocet and Vicodin. Over-the-counter medications can do the same thing. One of the most popular ones is diphenhydramine. This is Benadryl. So this is a very common allergy medication, but this is one of the dirtiest drugs out there. It has all kinds of fun side effects. It causes sleepiness. It causes you to have blurry vision. It can cause constipation. My wife thinks it's great because she gives it to our kids so they'll go to sleep. No, she doesn't. Well, I sometimes. But the problem with diphenhydramine is in all kinds of cold remedies and all kinds of over-the-counter medications. So you might be on some prescription antihistamines like hydroxyzine, and you get a cold or you just have some allergies, and then you go to the pharmacy and you get something over-the-counter that has diphenhydramine in it. Well, now you're on 2 antihistamines, and now you're going to feel even more groggier, or you might even have a further decline in cognitive function and things like that. So you really want to be careful with over-the-counter medications, especially cold medications. Talk to the pharmacist there. Tell them what medications you're on and ask them if this is really a good choice for you. Another example of an over-the-counter antihistamine is meclizine. This is used for seasickness. So if you're going to go on a cruise or something like that, a lot of times people like to take meclizine with them. Again, same deal. You might be on some medications already that can cause these same types of side effects. When you add another drug to that, you're just going to increase your risk of having a bad outcome. So supplements to improve memory. I have to admit, I don't know much about supplements. In the last presentation, the presenter, Helen, she talked about eating a good, healthy diet, right? You know, you really don't need supplements if you are eating a good, healthy diet, because all of these things are in food. One of the other things, so I learned two things in pharmacy school. I learned about the side effects, the can't see, the can't pee thing. And then I also learned that if you want to eat a good, healthy diet, when you go to the grocery store, just shop along the outside of the store. Don't go up and down the aisles. And if you plan it just right, you always end up in the wine section. So we seem to be coming back to wine a lot today. I don't know what that's about, but there are some supplements out there. Antioxidants, you know, Linus Pauling, Oregon State, right? He's our most famous alum, and he was all about taking lots of vitamin C. I don't necessarily advocate for that, but I'm not Linus Pauling either. Fish oils, so eat salmon once or twice a week. There's lots of fish oils that come in capsules. Make sure you talk to your pharmacist about, is this a good product or not? A lot of those supplements, they don't go through the same tests and rigors as a drug does through the FDA. So it may say it has 1,000 milligrams in that capsule, but it may actually have only 800 or 750. I know there's been studies that have looked at herbal medications as supplements and actually looked, is there really what they say that's on the bottle in that capsule? Some manufacturers are a little more reputable than others. So if you want to go that route, it wouldn't hurt just to talk to the pharmacist. And again, same type of deal with these types of herbal remedies. Not a lot of research out there about that, so I can't really speak to whether these work or not. If you think they work, great. But just be aware of what you're getting yourself into. You know, they can be very expensive, and just talk to your pharmacist before you go down this route. Okay, so that's it. Does anyone have any questions? So the question was about medical marijuana, and is there a danger in using medical marijuana? I would answer that question the same way I'd answer any question about whether you're going to take a drug. You know, you need to be careful with the dose of it. As we said earlier, your metabolism of your body slows down over time, and so when you're 20 years old, maybe one drop of medical marijuana is fine, but if you're 80, maybe one drop of medical marijuana isn't fine because it's going to stay in your body longer. So the active component in medical marijuana is something called THC, and so that's like any other drug. It's going to be broken down at a certain rate, and the longer that drug stays in there, the longer it's going to have an effect on the body. So if you're using it for sleep or something like that, you know, you're going to have to figure out what works well for you. You know, that particular drug hasn't really gone through the types of studies that's needed, and then the dosage forms that are needed to say, hey, you know, 2 drops is what you need for sleep, or 5 drops is what you need for hunger starvation or something along those lines. Does that make sense? So the question was about using melatonin to help relieve stress. And melatonin is a naturally occurring compound in your body. It's a hormone that helps you sleep. I've heard, from my understanding, the best uses of melatonin are for, excuse me, you know, it's escaping me. Like when you fly across the world and you come back, what's that called? Jet lag. So melatonin is used a lot for jet lag. As far as like reducing stress, I have not heard that. I have not heard that. Have you heard melatonin for stress?
I haven't heard it being used for stress specifically, but some people that have some short-term sleeping issues have used it effectively. Again, what Cory was saying about anything that is supplement or herbal, it's buyer beware, because you're not always assured the dose that is on the bottle is the dose that you're actually getting. But by and large, from what I've read about melatonin, it seems to be tolerated by many people without a lot of side effects. There's been some pediatricians that even use it in children at low doses. Of all the supplements that are out there, it's probably one of the quote-unquote safer ones, but again, because it's not FDA regulated, we don't have a lot of the studies to back that up.
Thank you.
You're welcome. Okay, thank you very much.
Thanks, Cory.